Welcome back, everyone. I'm Dr. Ross Kopelman.
And I'm Dr. Joel Kopelman.
So, Dad, I want to talk about a big topic. There's a lot of young men who are in their 20s and 30s who are experiencing hair loss. And they're all asking, should they get a hair transplant?
Very common question.
Very common. And there's intense marketing all over the place trying to get these young men to come in for transplants. And we have young men who come into our office interested in hair transplants immediately when they walk through the door.
Right.
But we don't think everyone's necessarily a candidate.
That's true.
So what I think we should both do is act as advocates and guardians to really explain, should you get a hair transplant? Are you even a candidate to get a transplant? Because I think there's a lot of misinformation out there.
I think you're right. I think that there's a lot of, as you said, a lot of intense marketing to get people to do transplants immediately. And we feel there are other steps and other considerations to take before you make that big decision.
Okay, so let's dive into it together.
We recognize that losing your hair, particularly at a young age, can impact you both socially, professionally, emotionally. We're here to guide you through this process because we feel that if you are in a big rush to make a decision, and this is a very important decision that can have long-term implications, and there are consequences of making this decision now on whether or not to have a hair transplant, we want to guide you through this process because we feel that too often people are heavily marketed to, and they're not thinking through all the steps that are necessary to keep you safe.
And they also might see a quick, cheap option.
Right.
Right? So they see like 5,000 grafts for a certain price and they think, oh, that's wonderful. I'm going to go get my hair. It's gonna look full. But the reality is that if you act too quickly and you look for a bargain, essentially, you could make a very poor decision medically long term in terms of the outcome that you want to achieve. Now, in the immediate, you might look great, but if you look out 10, 15, 20 years, and that's how we think, when we see patients, we don't just think about, okay, what Band-Aid can we put on this problem? We think about holistically, how is this patient going to evolve?
Exactly, because treating hair is a lifelong commitment. Okay, we know that you're going to lose more hair over time. That's a natural progression of hair loss in any individual.
And that's whether you're male or female.
Yeah, and we're trying to do what we can to retain as much hair on your head as possible without overgrafting these areas because there's a limited supply of donor hair follicles in the back of your head to fill in areas that are deficient in the front of your head. So you can't play your full hand immediately. You have to do it in a very graduated way so that over time you have enough grafts to fill in areas and to retain your appearance, your more youthful appearance.
When I do a consult with a male patient around my age, yes, I want to know what the progression of their hair loss has been like, how rapid their hair loss has been, but the number one thing I want to know, family history. Does your father have hair loss? Do your grandparents have hair loss? Any siblings have hair loss? In my case, I got very lucky. My father does have hair loss. I got the genes on the other side of the family because hair loss is polygenetic. But the big takeaway is that if you know the family history, if you know your family history, you will have a better understanding of how your hair is going to progress.
Right.
And then that allows you to make a decision.
Right.
Because
we want to determine whether or not it's safe actually to do the transplant at a young age. Because if everybody in the family has lost their hair by the age of 30, well then we have to take a step back and say, this may not be a safe bet to put grafts in the front of your head, because you might lose those follicles in a short time. So we really have to get the whole picture. We have to get a complete picture not only of you, but of the family as well. And then we can make an informed decision on whether or not it's safe to go forward.
100%. So that's why you don't want to dive in to a hair transplant right away.
Right. So if you see like people pitching you for having a 5,000 graft transplant immediately,
Which is an exorbitant amount of follicles to do in one sitting.
right, and it's inadvisable to do. Even if the price sounds too good to be true, don't do it, because long term you have to try to retain those donor areas that you might need down the line to fill in areas that you may progressively lose. In other words, you got to think of hair loss longitudinally over a lifetime.
Correct.
And you can't look at it in a single picture, because at your age you may be saying, well, I want to fill it in, I want to feel better, I want to be more confident. Those are good objectives. However, we also don't want you to play your hand completely and end up in a short period of time with hair loss in areas that need to be filled in systematically over a long period of time. And therefore, proceed cautiously. That's our message. Proceed slowly. Think through this whole process and ask the right questions to the hair transplant doctor who you're talking to. Because if they're encouraging you to have a large number of grafts implanted immediately, then you really have to think twice and maybe not proceed.
It's also important to understand how extensive your hair loss is. So there's something called the Norwood scale that's used by men to determine how extensive your hair loss is, and it goes from 1 all the way up to 7.
And in women, it's the Ludwig scale.
And in women, it's the Ludwig scale. And this gives you an idea of potentially how many grafts you need. And you might have pretty extensive hair loss. Now, what we think is critically important is to really address the front of the scalp, the hairline. So you might have a crown that is balding.
Right.
But we don't want you to jump and try to cover the entire area.
Right. So in the beginning, what you want to do is frame the face. You want to fill in the frontal areas, what's called the frontal forelock here, and you don't want to necessarily cover all the bases, because when you try to fill in all the areas, you may be depleting your graft donor area.
And you can get something called a moth-like appearance in the back when you over-harvest grafts. So be cautious, right?
Right.
If they're saying, oh, we could do one sitting of 5,000, 6,000 grafts, that sounds very dangerous to me.
Yeah, well, you're going to end up with potentially little scars back here that people can see through if you have what's called an FUE procedure, which is a follicular unit extraction. So you may have like a little punctate white scars back here, so they can't spread out the areas where they take the donor tissue from, because they want to remove so many donor grafts from the back of your head. So we want you to proceed in a conservative manner and take far fewer grafts initially, so that you will retain some of those donor areas for the future.
So by no means are we saying that you shouldn't have a hair transplant in your 30s. But if you do have a hair transplant, do a small case.
Right.
Fewer grafts, because it's likely you're going to need another transplant later on in life.
Yeah. The problem is really, though, Ross, is that some patients come in quite bald already. And in those cases, we may actually have to take donor hair follicles from other areas like the beard,
Correct,
or the chest, to fill in large areas that are missing. So again, everybody is different. Every individual sitting in front of us has different issues. And so you have to be customized. Everything has to be customized to the problem that we face in front of us. But we have to think long term on what the consequences of taking grafts and how many grafts and where to place those grafts. All those things have to be taken into consideration right from day one.
Now, this discussion is not complete without talking about medical therapy. If you start experiencing any level of hair loss, that's the time when you really need to integrate medical therapy into your regimen.
We're talking about in your 20s or 30s. So if you're starting to lose your hair in your 20s or 30s, you already need to be on oral medications, either dutasteride, finasteride, and possibly even minoxidil as oral medications, and maybe even topical medications as well. We have other options to offer you to stimulate your hair that you already have and stimulate the follicles before they already go beyond the point where they can't be reversed.
So if you're thinking about a hair transplant, the first thing you have to start with is medical therapy. Don't run to the transplant without first integrating some level of medical therapy, whether it's a topical or oral approach. And when you get the hair transplant, that doesn't mean your medical therapy treatments are done. This is a lifelong commitment, okay? And we always discuss this together. It's a lifelong commitment to maintaining your hair. So you continue your medical therapy.
Even after the transplant.
After the transplant, correct. And that is important. That's something that we have to drill down, and you really have to understand when you're trying to address your hair loss.
So this commitment requires you to come back to the doctor and ongoing therapy. This is ongoing, lifelong therapy to retain your hair.
And that's one of the reasons that we caution patients
To go
against,
overseas.
correct.
Or
Because those doctors are not monitoring you
right.
long term, and you really need to build that relationship with someone that you trust, that you can go to on an ongoing basis.
Right.
Doesn't have to be every month, but once a year,
Right.
depending upon how extensive your hair loss is, just to maintain you on medical therapy. So again, the two have to be paired together.
Right. It's not one or the other. It's a combined treatment. So we hope that you found this video to be informative. Now that you can make informed decisions about when to proceed with a hair transplant, what kind of things to think about, what kind of questions you should be asking your hair transplant doctors. And our goal is really to keep you safe so that you end up with a great result long term, not just short term. So these decisions you make today are going to have implications long term, and that's the takeaway message we have. Anything else you want to add?
So I was going to say that you really got a sense of our philosophy. It's about medical therapy paired with a hair transplant, and also knowing your family history of hair loss. Again, if you have any questions that we have not addressed, please leave them in the comments below. If you're new to our channel and have not subscribed, please hit that subscribe button, and we look forward to helping you along in your journey to regrow hair.